Good morning, Michelle, and to the viewers. Yeah, I mean, I think it is a concern, and it is very much a concern that we have. But, you would remember that last year we kind of went hard on banning sort of engagements in the open spaces. But this year, I think that the attitude is, if we had to choose between indoors and outdoors, we probably have to choose outdoors. Exactly how the outdoor engagements are regulated is something that is really under discussion. It's not easy to control the Durban beach beachgoers and the crowd there, and so it's going to be a real challenge in terms of managing that space, especially indeed. Now we are seeing an alarming increase in cases in the province. But I would say that, the consensus is we'd rather let people be outdoor. And then the question might just be exactly how do we do that?
Yeah. And how do you reckon we do that, Prof? I mean, the mask mandates around the country remains in place. If you are in public spaces, you are required by law to wear a mask. But as you say, how do we go about policing that?
Yeah, especially at the beach, because really people are going to get into the water and people are preparing and ready to get into the water. It's not easy. The one thing that I can say, Michelle, is that I've been very impressed with the province's management of large indoor events. So we've seen two major events. One was the Balido Rage Festival that was postponed because that was cancelled because, or I should say terminated because it had already started after people tested positive. And we've also seen a major conference at the ICC also moved to, which was meant to be hybrid, and it became completely virtual because of the increasing number of cases. And these I saw as responsible decisions by the Ministry of Health and the government here in the province. And so the question now is going to be exactly this. How can we regulate the outdoor activities? I am lost for how we can do it. I've seen how crowded the Durban beach gets. The only way would really be to limit the number of people who can get to the beach, but that's also going to be problematic. But trying to enforce masks on the beach is going to be a problem. And it's not also going to be easy to do rapid tests for COVID-19 for people that are going to the beach. It will be very difficult to coordinate. So, it's something that I think we have to think about. It's really only if we can reduce the number of people that are going to be at the beach, and people can only use masks, can take off their masks only when they're getting into the water. The rest of the time they have to put their masks on.
I mean, Prof, and there is that headline that I was telling you about. There it is up on the screens for our viewers to have a look at, and that is Sunday's throngs of beachgoers there. It's a sea of people, so to speak, Prof. I mean, Prof, at this stage of the pandemic, is this where we're at when we say at some stage we're going to have to live with COVID-19? So, it really is up to you and I how we behave in the face of the Omicron variant now.
Yeah, and this is the part where, when we talk about solidarity and we talk about people playing their part and people taking responsibility, this is the part that's really important, because really it is clear to me that, the state and government can really, and the health system, including the private sector, can really support us in terms of managing severe disease and hospitalization and any complication from that. But I think in terms of preventing new infections and managing mild disease and preventing spread from one person to the next is the responsibility of all of us. And any harsh measures to try and police that, it's going to feel intrusive for a lot of us. If we are really meaning and intending to live with it, we should not have to be policed to actually put on a mask. But I worry that I think, we are not yet at a stage where people understand that we have to do this without being policed, so that we can reduce the burden on our society and begin to allow our society to function as it should, at least to the best possible degree as we can manage. But we shouldn't have to be policed for observing precautions. That's really our responsibility and our joint responsibility. We should hold each other accountable to that.
Yeah, absolutely. Prof, I also want to talk to you about the research, the preliminary research that was released by the SA Medical Research Council just yesterday around the Omicron variant, specifically looking at the Tshwane district of hospitals. Are we at the stage now, Prof, and there's a reason why it's called preliminary data, I suppose, but can we say whether the Omicron variant is at this stage not leading to very serious illnesses? Because part of the findings also said that many of the people who were receiving treatment for COVID-19 in hospital were incidental cases that were identified, which means they were admitted for other reasons.
Yeah, for me, the report, what it tells us is that, we've got more cases of COVID-19 likely due to Omicron that we don't know about. Most people are going undetected because they probably just present with mild disease. And many of those incidental cases that were identified, they may have been missed if we didn't have the screening tools that we are using currently, especially the rapid antigen tests. In many places, even in events and so forth, a lot of people are being picked up because we are using the rapid test where you can get results very quickly. But I do think that the story, one part of the story is the fact that there is a lot more cases that are going undetected, especially with the evidence that shows that we are detecting them incidentally. The second thing, it's exactly this, that I think for the most part, a lot of people may be asymptomatic or have mild disease so far. But the question that you're asking is, can we say this conclusively yet? No. Because there is a stage of the infection where you have viremia or a large load of the virus, which is about the first week or so. And then there's a second stage where you really have the pneumonia that is really caused mostly by the damage to the lung from the immune response. And so if really we need to be conclusive, we need to be sure that we have covered enough time of observation for the stage where people are likely to go into pneumonia. So that time probably is going to be about the end of this week, early next week. We can tell with some conclusive confidence to say the early data shows that we are not seeing an increased number of pneumonia. We are hoping that that will be the case. The last part of the story is really that we need to actually see how the older age groups are responding to Omicron. Because when we are only seeing it in the younger people, and when I say younger people, I mean those under 40, then it doesn't really tell us so much about what we know when we compare to previous waves and previous variants in terms of how it affects the older people. We want to see what it will do there when we get more cases of slightly older people, for us to now be sure that we are dealing with something that is less virulent or less aggressive compared to the ones in the past.
I mean, the worrying thing, I suppose, Professor Moshabela, is the part where you say a lot of people are walking around with COVID-19 unaware of the fact that they are positive because they're not presenting with any symptoms.
Absolutely. And this is why we've been saying that, one of the strategies, major policy decisions that we need, if at all possible in South Africa, is to make testing really easy and accessible.
And
we have seen...
And not as expensive, Prof.
Not as expensive, absolutely. And we have seen in places where there are screening, especially just a rapid antigen testing, which has its own limitations. But for the most part, we have seen how many more people we have detected at events that we're screening that we would have completely missed. But when someone is diagnosed, it makes it so much easier for them to accept that they have got COVID-19. If you don't know, with a test result, you are biased to believe that it's just some cold or some flu, and so I can get away with it. I can carry on with my daily activities. But once you know, at least you now feel that sense of duty to be able to stay home and isolate if you can, but also to notify people you've been in contact with. So those who are feeling some symptoms, they can also test. And we are now also able to detect a lot more cases and prevent spread. And if someone begins to feel a little bit of shortness of breath and they've been diagnosed, they know that it's time to go get care. So these are important measures for us in terms of managing the spread and also managing the severity of cases. When people know because of diagnosis, we cannot manage it without making testing easy. And I think that's a very important part of the story from the results that we've seen from Tshwane.
Absolutely. Prof, I want to talk to you about another headline in one of the morning papers here in Gauteng, in fact, the issue around the Johnson & Johnson vaccine. And the fact that a single dose, in fact, is not acceptable in the rest of the world as providing full coverage for protection against COVID-19. Professor Shabri Mahdi, Professor Helen Rees, they are quoted in this article as saying, you know, around the rest of the world, it's 2 doses of Johnson & Johnson. I mean, this means that the almost 7 million people who have received a Johnson & Johnson single dose, believing that they are now fully vaccinated, are in fact not.
Yeah, I think we just have to, absolutely, this is important, but I think we do have to manage the narrative, Michelle, not to in any way suggest that they are not fully vaccinated, right? Because one of the things that has happened throughout this pandemic is that as we know more, we change the story. And it is very frustrating for the public every time we change the story. Because 1, it looks like we don't know what we are doing. 2, it looks like we are continuing to do experiments and things that are trials. But thirdly, really, it just creates confusion because people, unlike some of us, we are prepared to keep up with the changes in the evidence. But for some people, they want you to give them a message so that they can stick to that message. So whenever we have advances and improvements in our knowledge, we need to make sure that we capture the message such that it is not necessarily negating what we knew previously. We need to be clear that, you know, we now know more and we are adding on to that. So even in this case, I don't necessarily think that it means that, you know, they are not fully vaccinated. I do think that it means that we now know that we can improve their protection by adding another dose. And even the time lag between those 2 doses, you know, it doesn't necessarily have to be short like we do with Pfizer, but we do know that people then can benefit more. The evidence is growing that people can benefit more with the booster shot of another J&J or another mRNA vaccine. So I would say that they are still vaccinated, but we need to make sure that, yes, the evidence suggests that you can actually be further protected by another dose.